This presentation will cover the image analysis guidelines for the sternum. Let's start with the PA oblique projection, the RAO position. Image analysis guidelines for a PA oblique sternum state that the sternum should be demonstrated with homogeneous brightness. The manubrium, SC joint, sternal body, and xiphoid process are demonstrated within the heart shadow without vertebral column superimposition. The mid-sternum is at the center of the exposure field. The sternum is demonstrated without motion or distortion. Ribs and lung markings should be blurred if utilizing a breathing technique. The posterior ribs and left scapula will be magnified. The jugular notch, SC joints, sternal body, and xiphoid processes are to be included within the exposure field. The next slide just discusses the same image analysis guidelines that I just reviewed. So let's talk about how do we know if we are excessively rotated, meaning too much, versus under rotated or insufficiently rotated. Now we know that rotating the chest and sternum until that mid-coronal plane is angled 15 to 20 degrees with the IR is sufficient enough to position the sternum away from the vertebral column and beneath the heart shadow. In excessive obliquity, where there was more obliquity than needed to be, the sternum moves to the left of the heart shadow, and it will demonstrate excessive transverse foreshortening. So when you take a look at this image, it points out where the manubrium is and the sternal body. And see, the sternal body starts to move past that heart shadow here, which is pretty much right here. Once it starts moving past the heart shadow, we know, here's the sternal body, and we know that and I'm losing the end of it down here, but I'm assuming it's somewhere right here. We know that we are excessively rotated because that sternal body should be over top the heart shadow. In insufficient sternum obliquity, there will be portions of the right SC joint, which is pointed out in this image, the manubrium and the sternal body that are positioned still over top the vertebral column, and we don't want that. So then you should automatically know that once you see that right sternoclavicular end is still over top this vertebral column here. Here it is demonstrated. And your manubrium is like right here. We are not sufficiently rotated. So you may want to, or you would want to increase your rotation to that 15 to 20 degree RAO position. So let's take a look at this. PA oblique sternum projection analysis. When looking at this patient, we can obviously see the manubrium and sternum in profile, but there's a big issue when you're looking at this image. First, we should notice that the sternum is not located over the heart shadow. This should indicate to you, there is a positioning error. Looking at this patient was actually placed in an LAO position where the left anterior portion of the body was closer to the IR. To correct this imaging error, we need to place the patient in a RAO position where the right side, right anterior side is closer to the IR. Let's move on to the lateral sternum projection. Image analysis guidelines for the lateral sternum projection state that the manubrium, sternal body, and xiphoid process are demonstrated in profile. The anterior ribs are not superimposed over the sternum. The sternum is demonstrated without superimposition of the humerus or the soft tissue of the humerus. The sternum should be demonstrated with minimum magnification, and the mid-sternum is at the center of the exposure field. The jugular notch, sternal body, and xiphoid process should all be included within the exposure field. The next slide here provides for you the image analysis guidelines. So let's talk about how we determine rotation on a lateral sternum. Rotation is effectively detected on a lateral sternum projection by evaluating the degree of anterior rib and sternal superimposition. If the lateral sternum projection demonstrates rotation, the right and left anterior ribs are not superimposed, meaning one side is positioned anterior to the sternum and the other side is positioned posterior to the sternum. So how do we determine which side is anterior? Since the heart shadow is located in the left chest cavity and it extends antero-inferiorly, outlining the superior border of the heart shadow enables recognition of that left side of the chest. So, therefore, if the left lung and ribs are positioned anterior to the sternum, the outline of the superior heart shadow continues beyond that sternum and into the anteriorly located lung. And just conversely, if the right lung and ribs are positioned anterior to the sternum, the superior heart shadow does not continue anteriorly situated in the anteriorly situated lung, but ends at the sternum. So let's take a look at some imaging demonstrating this. When looking at this first projection with the left lung rotated anteriorly, you can see here's the heart shadow extending, a little out, okay? It is in the anterior portion of the wall there. So you know that the left side is rotated anterior. So let's go on to the next. So in this projection, our heart shadow, which is a little bit more difficult to see here, is starting to end right around here. So we know that this space here is actually the right lung positioned anterior to the left because that heart shadow isn't extending to the wall outside there. This concludes our image analysis of the sternum. If you have any questions or concerns, please feel free to reach out to me by email or when I'm at clinic. Thank you for participating in the image evaluation.